Hello, dear students. Hope you all are fine. So, today we are going to start a new topic that is World Health Organization population related programs. So, before going to the main topic, let us first know about what are population policies and programs. So, population policies and programs highlight various steps and measures taken by the government administration to reduce the growth rate of the population. It includes action taken by government in the form of a statement of position, laws, or administrative programs. It also aims to bring about qualitative changes in the membership of the territorially circumscribed population under the government's jurisdiction. So, from here, we can understand that population policies and programs are those measures that are undertaken by the government of a particular country in order to reduce the growth rate of the population by taking various kinds of action in the form of laws and other administrative programs. Next, World Health Organization. So, the World Health Organization is a specialized agency of the United Nations responsible for international public health. This organization was established by Constitution on 7th April 1948 and its headquarters is at Geneva, Switzerland. The World Health Organization is a member of the United Nations Development Group and it is engaged in various kinds of health related activities. The World Health Organization Constitution states that its objective is the attainment by all people of the highest possible level of health. Therefore, World Health Organization always aims that every people of the world have good health and they maintain a healthy environment. The current priorities of World Health Organization include communicable diseases, in particular like HIV, AIDS, Ebola, malaria and tuberculosis, sexual and reproductive health, development and aging, nutrition, food security and healthy eating, occupational health, substance abuse like use of various kinds of drugs, alcohol, and other intoxicant substances, and driving the development of reporting, publications, and networking. Therefore, we can say that World Health Organization is engaged in various kind of health related problems and it tries to work for the betterment of health of every people of the world. Now, let us discuss about the present role played by World Health Organization. So, World Health Organization is playing some very important role at present. They are, first of all, providing leadership on matters critical to health and engaging in partnership where joint action is needed. So, World Health Organization provides leadership on various matters related to health, health issues, various kind of diseases, and it also provides partnership to its member state and various countries those who are going through various kind of critical health problems, and it helps them in taking joint action whenever it is required. Next, we have shaping the research agenda and stimulating the generation, translation, and dissemination of valuable knowledge. So, here, World Health Organization as the custodian of norms and standards for health information and research will support countries in the identification of research priorities and product gaps that will give new areas of investigation and innovation. The next role of World Health Organization is setting norms and standards and promoting and monitoring their implementation. So, World Health Organization will set various kinds of norms and standards and also will work upon its implementation in the various countries. Next, we have articulating ethical and evidence-based policy options. So, here, World Health Organization work on patient safety facilitates the development of patient safety policies and strategies in its various member states. So it will focus on the safety of the patient, and also it will try to develop policies and strategies related to the patient safety. Next role is providing technical support, catalyzing change, and building sustainable institutional capacity. So, World Health Organization provides various kind of technical support, and it also catalyzes changes and tries to bring and build sustainable institutional capacity. Lastly, we have monitoring the health situation and assessing health trends. Here, it includes to improve quality analysis and use of country and regional health information for better measurement and accountability of health. So, World Health Organization will try to collect various health related information from countries and from the regions so that they can take a better measurement related to health. Next, we will discuss about the various programs undertaken by World Health Organization for the development of population. So, first of all, communicable diseases. In the year 2012 to 2013, World Health Organization budget identified communicable diseases and HIV, AIDS, malaria, and tuberculosis in particular as the focus. Combating these diseases in the population will lead to the development of population quality, and it also aims to eradicate polio by working to immunize young children and prevent the re-emergence of cases in countries declared polio free. Non-communicable diseases. The prevention and reduction of disease, disability, and premature deaths from chronic non communicable diseases, mental disorders, injuries, and visual impairment. So, this is the another priority area of WHO where it is trying to prevent various kind of death that is related to non-communicable diseases. Next, we have life course and lifestyle. World Health Organization also works in order to reduce morbidity and mortality and improve health during key stages of life. These key stages will include pregnancy, childbirth, the neonatal period, childhood, and adolescence. It also tries to reduce the risk factors for health conditions associated with the use of intoxicant substances, unhealthy diets, and works to improve nutrition, food safety, and food security. Emergency work. Its primary objective is to coordinate with member states and other stockholders in case of natural and man-made emergencies to reduce avoidable loss of life and the burden of disease and disability. So, WHO will focus on how to reduce the loss of life and the burden of various kind of diseases by coordinating with its member states and the other stockholders. Next, we have health policy. WHO addresses government health policy with two aims. Firstly, to address the underlying social and economic determinants of health through policies and programs that enhance health equity and integrate pro poor gender responsive and human rights based approaches. Next, to promote a healthier environment, intensify primary prevention and influence public policy to address the root causes of environmental threat to health. So, these are the two aims focusing on which WHO addresses government health policies. Then we have health and development works. WHO works on health and development works and is concerned with the impact of better health on development and poverty reduction, and conversely, with the impact of development policies on the achievement of health goals. Next, we have health and poverty. So, World Health Organization also supports countries in order to design and implement pro poor health policies which prioritize and respond to the needs of poor people. It also ensures that the health perspective is reflected in poverty reduction strategies and helps develop sector wide approaches. So, these are some of the programs undertaken by World Health Organization for the development of population. So, from today's discussion, we have come to learn about the concept of population policies and programs, the concept of World Health Organization and its present role or function played, and lastly about the programs that are undertaken and focused by World Health Organization for the development of population. So thank you dear students. Hope to meet you in the next class.